Mr. Lucas came to us from Kenya. His problem was severe gastroesophageal reflux, and for which he had undergone evaluation and a subsequent surgical procedure to treat the reflux in Kenya in 2021. However, after the surgery, his symptoms worsened and he was unable to have proper intake of food with repeated episodes of vomiting. He underwent more tests in Kenya, and after evaluation, he underwent 2 more surgical procedures. Unfortunately, his symptoms persisted. He continued to have a feeling of fullness after meals, a feeling that all food had got stuck in the chest, and then a few hours after his meals, he would have vomiting.
As Vivek has just explained, this patient Lucas came to us from Kenya. We discussed all the options also with the patient and then took a decision that we should operate this patient.
We evaluated him doing an endoscopy and a CT scan after giving contrast by mouth, and found that he had an angulated junction of the food pipe with the stomach, because of which the food would collect inside the stomach after eating, and he would only be relieved once he had vomited that food out. In view of the multiple surgeries he had undergone in the past, which involved both the abdomen and the chest, we decided to proceed with open surgery after counseling the patient.
So with a lot of difficulty, we were able to mobilize the stomach and bring it down from the chest into the abdominal cavity and fix it up there. And along with the fixing of the stomach in its normal position, we also did another anastomosis. Since he had already 3 surgeries, we thought it will be a safer thing to do another joint with the stomach. We did another gastrojejunostomy and a feeding jejunostomy to cover that up, and fortunately he tolerated the surgery well. Post-operatively, within a week, he was discharged. He was moving around on the 2nd, 3rd day and did very well.
Thanks to Dr. Govil and Dr. Tandon for their expertise, and I would not hesitate to recommend anybody to this hospital for the kind of treatment that I have gone through, and I now have a new lease of life. Thank you very much.
We all are very happy for the outcome for this patient.
I am happy to be here today, and I want to take this opportunity to sincerely thank Apollo Hospital, and more specifically Dr. Deepak and Dr. Vivek for the wonderful job that they have done on my husband.